I felt like when I was looking through programs as a fourth-year medical student, I wanted the combination that I think most folks want. They want a busy program, lots of consults, lots of cases, but also wanted a place that had the opportunity to provide academic exposure as well as opportunities in case those were what I wanted to pursue as well. And I think this checks both those boxes.
I wanted an incredibly balanced program because I wasn't sure what I would go into, and I continue to have difficulty choosing what I want to go into because all of our rotations are so enjoyable.
I think also the underspoken part of this program is that it is extremely well-rounded in that you do every rotation twice, once as a junior and once as a senior. And I feel that overall every department is very strong here, which I feel is much different from other places across the country.
I actually rotated here as a fourth-year medical student. I went to medical school in Philadelphia, and I wanted to kind of see other parts of the country and what kind of other programs there were out there, and rather than just the Northeast programs. So I came to Vanderbilt, and I was just so impressed by all the residents and how well they work together and their kind of teamwork, and also just how knowledgeable they were.
There are a lot of great things about this program. One of my favorites though is how resident-centered it is. From the chair of the department through the faculty to how we conduct interactions with each other as residents, there is such a culture of support and teaching and education that really permeates.
As medical students, we help take overnight call, which here at Vanderbilt can get pretty busy, especially in the summer and the trauma season. And just seeing the PGY2s who were early in their PGY2 year take care of those really complex, complicated patients overnight, I was just kind of blown away at how well they were able to do that and with such confidence. And I wanted to be like that. And so that's ultimately why I chose to come here.
We're one of the few level 1 trauma centers in the area, and we therefore receive tons of orthopedic trauma on call.
We work hard here, but we leave here good leaders in addition to having good operative skill and sound clinical judgment. And I think that's a fair price to pay for 5 years that are going to serve as the foundation for the rest of your career.
I think it's very important, the reputation of where you're coming from. And when somebody hears that you're coming from Vanderbilt, they hold you to a high regard and also respect the name of where you're coming from.
If I were to do it again, I would definitely pick Vanderbilt.
You know that you are going to be learning from top-notch surgeons. You're going to be seeing all of the consults down in the emergency department. And when you graduate from here, I have full confidence that I will know so much more in terms of orthopedics than what I knew when I walked in.
I can say without a doubt that coming from Vanderbilt, you have any opportunity open for you that you would want.